Testing, 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 testing. Okay. Hi everyone, welcome to my channel. My name is Paula and I had open heart triple bypass surgery, also known as CABG times 3, at just 36 years old. I created this channel to share my journey, not just to document it, but also in hopes that it might help other people going through similar situation that I did. Yesterday was the 12th week milestone of my CABG surgery. It's officially 12 weeks. I have many video ideas firing off in my head. I just figured that I'd start with how I found out that I had severe heart disease at 36 years old. This video might be long, but I think the more information is shared, the better. I also wanted to start out by saying that every body is different, so what I'm sharing with you is my experience, and everyone has a different story in terms of how they recuperated, what happened. So just wanted to remind you guys out there because I had some times where I was very frustrated. So I guess I will start with the beginning of 2024. My husband and I were getting ready to start a family. It had already been 7 years since I found out that I had high blood pressure and high cholesterol. But I always thought that there was something else that was wrong. So we went to go see a new doctor, a new PCP, and when he looked at my labs, he ordered your typical blood work. He saw my LDL levels, and once again, another doctor who said that he's never seen LDLs that high in his life with his other patients. And mind you, the typical normal numbers are around 70 to 100 milligrams per deciliter. So that if you're in Europe, that translates to about 2 to 2.5 millimoles per liter. My numbers were 400, a little over 400, which translates to about 10 in Europe. So my numbers were 4 times the normal amount. We decided to try lowering my LDLs through statins, and I was very hesitant to do so, but because, again, we wanted to start trying for a family, I went ahead and we started doing that. But I experienced a lot of negative side effects with the statins. I was very fatigued, and I started gaining weight, and it also increased my A1C levels. And my A1C levels were usually around the pre-diabetic range. So the highest I think was 5.7, but it ended up going up to 6.1 at some point while I was taking the statins. And I was just so tired, and I didn't understand why. I guess I understood that it was because of the statins, and it was just very frustrating. I stayed on the statins for 9 months, and at the same time I also started seeing a new cardiologist. He didn't see any major red flags and said that we could start trying soon. Since statins are not safe during pregnancy, I stopped taking them because you have to stop taking them 3 months prior to you even attempting to start trying for a baby because they're not very safe for pregnancy. So I stopped taking them around, I think it was September or October. And at one point, I did mention to my cardiologist that I do experience some chest pains now and then, and he didn't think anything too negatively about it. And I did also mention that I think it's possible that it's musculoskeletal, or maybe the way that I sleep at times. I tend to sleep on my side every now and then. So just to be safe, he ordered an echocardiogram and a stress test, a regular stress test. The echo showed mild regurgitation, and it's not really that abnormal because I do have high blood pressure, and sometimes that happens when you have high blood pressure. There's just some backflow with blood sometimes. But with the stress test that I took, it showed some abnormalities with the way that my heart recovered after being on the treadmill. So what they do is you go in, you hop on the treadmill, and they look at your, I think it's the ECG. So they look at the way that your ECG goes before and after being on the treadmill. My heart rate took a long time to get back to normal levels. So my cardiologist wanted to order another stress test, but this time it was a nuclear stress test. The process was similar, but with the nuclear stress test, they inject a radioactive tracer, and then they put you underneath an imaging, I think it's called a SPECT, S-P-C-E-T. So what they do is they look at how your arteries, or however your cardiovascular system works before and after you are on the treadmill. Again, results were similar to the first one, and it took a while for my heart rate to lower again. There were issues with the ST waves. It showed possible ischemia, meaning reduced blood flow to your heart. At this point, I still wasn't very concerned because I didn't feel too off or anything. It was just that I was always tired. So for good measure, my cardiologist ordered a CT angiogram. He walked me through it. He said that now we have to rule out, we have to look at your arteries a little more closely. I went on vacation in November, early November. And then when I got back, I kept getting sick. I kept getting a cold and respiratory issues. It wasn't COVID, but I just was having respiratory issues for a couple of months. So I wasn't able to get my CT angiogram until mid-March. It was almost end of March. So end of March, I went to a separate CT angiogram facility, and I was prescribed Metropolol to help lower my heart rate. So your heart rate has to be, I think, below 70 beats per minute, or I think it's preferred that it's around 60 beats per minute. And my heart rate is usually a little higher, so even when I was at the facility, they had to administer the liquid version of the Metropolol, or the IV version of the Metropolol, and it was the max amount because my heart rate just wouldn't lower. And again, it's done through an IV. They put a line, and once my heart rate was lowered to, I think it was 65, they helped me walk to the CT scan area. I laid down on the bed, and the radiologist was very helpful in telling you what to expect. He did also warn me that if I felt like there was warm sensation down there, like it felt like I was peeing, it's completely normal. Like I said, during the process, the radiologist keeps you informed via the intercom. And so he was telling me that, okay, we're going to inject you with the saline solution. And he actually had to stop because there was something wrong during that first initial administration of the saline solution through my IV. And he looked at everything checked out, it was fine. So we went ahead and did the saline solution again. And then next was the dye. With the dye, I felt burning through my wrist, and then up through my arms, and then my head, and then it went down to like the lower part of my body. And it did feel like I had to be. The whole process itself, the CT scan portion of it was very quick. It was maybe, I think it was like 5 minutes. And the process prior took longer than that part, because I think the preparation took maybe 2-3 hours. And again, it took longer because my heart rate wasn't lowering. After we left, my husband and I went to a restaurant to go have lunch because I hadn't eaten all day. And on the way back home, we were already in the car, I received a text message that my test results were available. I was like, oh, great. I thought it was going to take like a day for them to get back to us. But when I opened it up, the first few words that I saw was more than 70% obstructive coronary disease of the LAD and RCA. And as I was reading my results, it wasn't even 5 seconds after, I received a phone call from my cardiologist. I picked up the phone and he asked me if I had read my results already. I told him I was actually just reading it. So he went over what the findings were, and he basically told me that I would need to come in to do the more invasive procedure, which is the catheterization through your arteries. Like they would have to go through one of your arteries on your right or your left wrist. He said that if it's not that bad, they might be able to intervene through stents, but he also just wanted to warn me that there's a slight possibility that I might need open heart surgery. So he said, you're probably on your way home now, so let's just talk about this when you get back to my office for our follow-up. And I was just a little bit in shock at that point. So we hung up and I was just silent on the way home. I couldn't help but blame myself. I was blaming myself for not being forthcoming about my situation because of my family history and my high LDLs for a few years. And I was just very frustrated. So on the way back home, again, I was silent. And at one point, I just lost it. I just started crying. So my husband actually brought me to my parents' house and we talked about what was going on. Because my dad, when he was 37, my dad had his heart attack and he needed a stent. So 36 years old, it lines up that this was happening to me, but I also have a few other factors that I believe played into why this happened, and I'll discuss that in the future. So they were also shocked and scared, of course, but we all agreed that we would just need to wait for my catheterization to see how things would move forward from there. So I had my catheterization on April 1st. I was not allowed to eat or drink anything for a certain amount of time before the procedure. And at this point, I was still very positive. And actually, I think I was a little bit delusional because I read the results of my CT angiogram. There's a portion on there that said there were artifacts that were found, and I looked it up and it said like artifacts mean the pictures, the images weren't really that clear, and that could mean the results could be overestimated. So I was like, yes, it's possible that my results were overestimated, so I might not even have any problems. So I was like, I don't have any blockages, I don't have any blockages. That's what I kept saying. And I even told my mom, I don't have any blockages. Again, I was being delusional. When we spoke with the doctor who was in charge of the catheterization, he was also confused as to why I was even there, because I am 36 years old. I present as a young, healthy person, and I even told him that I go on the Peloton a couple of times a week. And he was like, yeah, we'll just take a look at, your system. And he was like, why are you here exactly? And there were a few answers, and eventually I said, well, I do have high LDLs and family history, and that's why we're here. We did a bunch of tests and it led us to this moment. And he was like, okay, we'll take a look at what's going on and we'll see how to proceed from there. So for the catheterization, I did have to put on a gown. You're at a hospital when this is done. You're at a cath lab. So there's a lot of waiting again. And eventually they do wheel you off into the cath lab, and I had to go from my waiting bed onto the cath lab bed. And I would describe everything as kind of like a pit stop, and it was incredible because everyone had their task that they did, and again, it was like a pit stop. Like, it was just very quick, very precise. Each person had their role and everything was done methodically and precisely. Once I was laying down, they were prepping me. I was asked to hold on to this bar with my right hand because they were going through my right radial artery. They also told me that some people, or it varies per person to person. Some people don't remember anything that goes on. They're sleeping, but some people remember, or they're aware of their surroundings, they're aware of everything. I was one of those people, unfortunately. I remember what was going on. I was awake. I had my eyes closed, but I was aware of what was going on. They administered medical grade sedation. And again, I had my eyes closed, but I was aware of what was going on. It calmed me down, like I felt my chest go down, and I wasn't anxious. I mean, I guess I was in my brain, but my body was not. It was relaxed. They inserted the catheter through my right radial artery until it went to my heart. At one point, I said to myself, uh-oh, they found something. So at the end of it, the doctor leaned in and he told me, okay, I'm so sorry, but we did find more blockages than we had anticipated. So I'm going to speak with your husband now and we'll discuss how to proceed from there. And at that point, I was just in shock. I was just staring up at the ceiling. And one of the nurses came by. The doctor had already left. One of the nurses came by and he said, I am so sorry, but he's right. We did see more blockages than we had anticipated. And right after he said that, I guess everything settled and I just started sobbing. So they brought me to the recovery room and I had an IV bag, and that was to make sure I was hydrated. My husband eventually came in, and it's funny now when I think about it, but I really had to go to the bathroom at this point. My bladder was really full. So whatever it was that we were discussing, like my husband was really serious, but I could not understand anything anymore because I just really wanted to go pee. So I kept asking the nurses. They gave me a banana bag, I forget what it's called, and you basically pee in it, but I couldn't use it. So I asked. Right, my battery died. So I think I was talking about the banana, what is that called? It's called a Purewick. So the Purewick did not work on me. So I had to ask if I could go to the bathroom because my bladder was like really, really full. So when I was in the bathroom, I was not lying. I think I went for close to a minute. It was just kept coming out. So eventually, after I stopped, I went back on my recovery bed, and one of the nurses also told me, this is the best possible situation that you could ask for because open heart surgery, like for long term, it's better than stents. And I still was not very accepting of it at the time. I just couldn't believe that this was actually happening. At one point, I even told my husband, I am not doing this. But anyway, so yeah, that's the story of how I found out that I had severe cardiovascular disease. And when I read the results, it was actually found that I had 3 blockages. So instead of 2, I had 3. And it's not like they were just at one point. So it was more complicated. Like a bunch of my branches, I think, were also clogged. And that's why the doctors couldn't intervene through stenting. And by the way, the doctor did tell my husband that I was a ticking time bomb. And he told me that I need to stop with the Peloton right away. So at the waiting room, he suggested that I speak with the head of surgery because my situation was a little more complicated and I'm so young. It would be best that the head of cardiothoracic surgery would do my surgery. So we spoke with him very briefly. I think he just came out of another surgery, and he did say, okay, this is what I'm seeing with your catheterization test results. What we're going to do is we're going to harvest arteries from either your left or your right radial arteries, and also the BIMA, the BIMA, which is the mammary arteries behind your chest wall. And yeah, it was then that basically I was told that I would need triple bypass surgery. After we spoke with the surgeon, I felt an odd sense of calm. And I don't know if it's because I felt like, okay, now I have an answer for what was wrong with me, or maybe because now we have a solution. So I felt really good after that conversation. Just so you know as well, after the catheterization, there was no intervention needed, so I was able to go home. On the ride back, I was okay. Like I told I called my parents right away and I told them what happened. And I hung up the phone and I just started feeling very, very dizzy. And I thought that maybe it was because I hadn't eaten all day. So we went straight to go to a fast food restaurant and we ordered a few things and I ate. I thought I was starting to feel better, but once we were in the car again, like riding on the road, I felt very nauseous and dizzy again. I thought I was going to pass out. So that's something to look out for if you are going to go through the catheterization. And I believe that happened because of the sedation. I was still very dizzy. I think I was still slightly dizzy until the following day. Also, something else is that because they do look into your heart rate with the catheter, you kind of have to be careful with what you do after that. At one point, like I just felt like my heart wasn't the same after that. I felt like my heart could give out at any minute. There was one point, I think it was a few days after my catheterization, I was being really good with my diet and I had this pastry, like just one small piece, like maybe like this big. And I walked up and down the stairs maybe 3 times. And by the 3rd time I walked downstairs, my heart was racing and it was pounding. And I felt really scared about that. But thank goodness my cardiologist also prescribed nitroglycerin. And he said if you ever feel anything, like you should take it. So I did take the nitroglycerin. And anytime I started walking again, my heart would start pounding. So I decided to go just lie down on the couch for a little bit, and I think it was about 20 to 30 minutes before everything felt normal again. So those are just some things to look out for after your catheterization. And yeah, that's how I found out that I had severe cardiovascular disease. My next video, I guess I'll talk about the surgery itself. I kind of went over it with my YouTube shorts, but I think that maybe talking about it will also help me as well. There wasn't really a lot of crying after that. I think I only cried once after, but I really tried to prepare for the surgery, so I'll talk about that in the next video. So thank you so much for watching, and I hope to see you soon. Please like and subscribe, and thank you very much.